So hi, hello everyone. So I am VC Sridharan, Assistant Professor from SNS College of Physiotherapy. So in this video, we're going to see about an electrotherapical application which is known as moist hard pack. So in this video, this PPT covers so what are the principles, physiological effects, clinical applications, and also the safe practice guidelines for how to use the moist hard packs. Okay. So generally and main principles and what are the general understandings about the moist hot packs are, so while applying the moist hot pack for a person or the patients, it mainly transfers the heat from one state to other. So in these cases, the heat is transferred from one state to other through the conduction method. Then after, while applying the heat, it mainly helps in the vasodilation, as the vasodilation is nothing but the increase of the blood flow. And finally, it also increases the metabolic boost rate, which is nothing but fostering the cellular activities. So next, what are the physiology of the superficial moist hard pack heat? So superficial heat is nothing but the moist hard packs. So while applying the moist hard packs on the patients, so mainly it increases the local temperature. So whether at the place where we applies the moist hard pack, it increases the temperature on that local region, and also increases the metabolic rate. And finally, it also increases the nerve conduction. Due to that increase in the increase or changes in the nerve conduction, it mainly helps in the reducing the pain level, and finally it gives a relaxing effect on the region where we apply. So it mainly helps in relaxing the muscle. So majorly, what are the clinical conditions which are used for using for the moist hard packs are? So generally or majorly, it mainly covers for the pain management conditions. So if whether the patient is having a pain, so some of the physiotherapists may prescribe to apply a pain management something like the moist hard packs. And if the patient whether have a muscle spasm, it is also condition which is used to prescribe as a moist hard packs. So in muscle spasm conditions, while applying moist hard pack, it helps to reduce the tightness of the muscle, and finally it also increases the flexibility in the muscle as well as the joint. So it helps in also increasing the range of motion of the patients. And due to electrotherapy and due to applying and heat, so we have some of the safety precautions for applying the before applying the patients. So mainly it comes under the concentrates on the contraindications. So which are the conditions which are not applying for a moist hard packs are? So some of the contraindications first one is an acute inflammation. So moist hard packs are generally used for a chronic inflammation conditions only. In acute inflammatory conditions, the cryo is the main option for their applications. And then if the patient having an impaired sensation, whether increase in sensation, hypersensitivity, or else also in hyposensitivity, so due to this impairment in the sensations, it is a major contraindication for the moist hard packs. And third one is an malignancy. Malignancy is nothing but a patient is affected by a cancer, tumor, something like that. So for the patients having malignancy, while applying moist hard packs, it increases the proliferation of the cell. Now we're going to see about the precautions for the moist hard packs. So what are the general precautions are? First, we have to check the skin integrity level, and then we have to avoid the excessive pressure while applying the moist hard packs, and then we have to monitor what are the adverse effects that after applying to the moist hard packs. So generally, before applying to the patients, we have to check the proper equipment and preparation of the moist hard pack applications to ensure that it is having a correct temperature level and also have a correct and appropriate size of the packs and covers. Next. So so how can we master the application of the moist hot packs, sir? So first we have to position the patient in the comfortable and in the accessible way. Then after we have to wrap the pack. So moist hot packs are wrapped by using the towels, and then by applying multiple towel layers, it helps in the comfort zone of the patients. And finally we have to apply gently for the evenly distribution of the heat to the patient. And what are the optimizing treatment outcomes are? Generally it comes under the duration, frequency and monitoring. So duration, it mainly and majorly, if suppose a patient is treated with moist hot packs, the major duration for the treatment is up from 15 to 20 minutes, sorry. And then frequency is daily, it can be applied from 2 to 3 times a week. And then monitoring, we have to check every 5 minutes for the skin whether they have any skin irritations or something other than skin redness, something like that. So what are the post application care of the patients are? So after finishing the moist hot pack application, so we have to reassess the patient for to evaluate the pain, whether the patient is having a reduction in pain or not. And we also have to check the range of motion, whether the range of motion is increased or not. Then we have to inspect the skin, whether they have a redness or something, whether they have a skin irritation or skin edema, something like that. Then after we have to do a documentation. So documentations are helping in treatmenting the patients whether they have an previous or an afterwards for an some other treatments like that. So thank you. So we're gonna see about a next condition on the next video.